Hello everyone, on behalf of Moja Ramesh Amti's Health Tourism Company, I'm here with you again to talk about another one of our medical treatments that we offer in Iran to our foreign patients. I'm going to briefly explain about abdominoplasty, or commonly referred to as the tummy tuck surgery. Basically, this procedure involves removing excess fat and skin, and in some cases restoring the weakened or the separated abdominal muscles, and to create a smoother and firmer profile in the abdominal area. Uh, Usually, even people with normal weight and body proportion can experience loose or sagging abdomen that can be caused by previous pregnancies, previous surgeries, aging, heredity, and significant fluctuations in weight. You need to consider that abdominoplasty is not a substitute to weight loss or an appropriate exercise program. And while a tummy tuck surgery is supposed to be permanent, future significant fluctuations in weight can diminish the results of your surgery. So if people who are planning for future pregnancies or weight loss are advised to postpone this procedure. Also, one thing to consider is that a tummy tuck surgery does not correct stretch marks. Although if they exist in the areas of the abdomen, skin of which are going to be removed, the stretch marks will be removed too. And who are good candidates to opt for this surgery? People who are physically healthy, at a stable weight, and who have realistic expectations, who are non-smokers, and people who are bothered and irritated by the appearance of their abdomen. Before this surgery, what is very important for you is to have a very extensive and candid consultation with your surgeon, which is usually a plastic surgeon, about your surgical goals, your medical history, your overall health, the medications you take, drug, alcohol, or tobacco use, and any previous surgeries that you have. The surgeon will also evaluate your general health, your pre-existing medical conditions, which are very important for this surgery, and he or she may take photographs of your body and discuss your options for the outcome. And the result of your surgery is very, very dependent on this extensive talk that you're going to have with your doctor. So you need to have that in mind. While tummy tuck surgery is a very popular cosmetic surgery, there are risks associated with this procedure, such as the risks of anesthesia, asymmetry, bleeding, fat necrosis, which is the dead fat issue found deep in the skin, vein thrombosis, or cardiac or pulmonary complications. Other risks are scarring, the possibility of a revisional surgery, infection, or unfavorable scarring. These are risks that your surgeon will comprehensively discuss with you before you consent to this surgery. So the next step is how to prepare for this surgery. Before the surgery, if you are a smoker, you need to stop smoking for some time before the surgery and stop taking aspirin or anti-inflammatory medications that can increase the risk of bleeding. You also will have to go through lab tests and medical evaluations, and certain medications or adjustment of the medications that you currently take by your surgeon. Now, how does this procedure work? This procedure can be done in ambulatory office-based centers or a hospital. It can be an outpatient surgery, but it is recommended to stay at the hospital for 1 or 2 nights after the surgery to be under supervision. And the step 1 is that you will go mostly under general anesthesia or intravenous sedation. Then the surgeon will make an horizontal incision between your belly button and the pubic hairline. The length and the shape of the incision depends on the extent of the fat and skin removal, and then the skin is lifted, and excess fat is removed, and the weakened muscles are restored, and maybe a second incision will be needed around the navel, around the belly button, to remove excess skin in the upper abdomen. Then when all modifications are done, the skin will be pulled back down like a window shade, and the excess skin will be trimmed, and the remaining skin will be sutured back together. In cases a new opening for the belly button will be created, and the belly button will be sutured into position. And step 3 is closing these incisions either by sutures or adhesives or tapes and clips. That's about the surgery. How to recover from this surgery? After the surgery, you will have bandages over the surgical incisions, and you may be wrapped with an elastic bandage or a compression garment to support your abdomen and minimize swelling. In cases, there will be inserted thin, small tubes to drain out the excess fluids or blood during the recovery. Your surgeon will then instruct you how to care for the incisions and the sutures, and the medications that you will need to take, and you will have a follow-up appointment with your doctor too. In our next video, we're going to talk more about the post-operative instructions for the recovery. The final result of this surgery is can be obscured initially because of the swelling and the fact that you cannot stand upright immediately after surgery, but after 1 to 2 weeks you will be able to stand upright and tall with a slimmer and your new profile. One thing to remember is that the scars from this surgery may take months to fade, and during recovery you need to be very careful that the sutures and the surgical incisions are not subject to excessive force, motion, swelling or abrasion, which we will talk about more. Now, what we do for you in Iran. We have 3 packages ready for you, which the prices of which start from $2,200, the first package without accommodation, but all other medical procedures are included, including translation, a 1-day city tour or excursion in the city of your procedure, and the other 2 packages will offer you a 6-night stay in 3-star hotels or a 5-star hotel. The price of surgery in Iran is remarkably lower than in countries of the region or in Europe and in the Americas. That's why we urge you, if you have in mind to go through this procedure, to come to Iran and to us specifically to have this surgery, as Iranian surgeons are all experienced in this area and are board certified with years of experience of plastic surgery, and the fact that the cost of medical care in Iran is specifically lower for foreign patients. If you have any questions regarding this surgery or the packages, please contact us through our social media, Instagram, Facebook, our website, amitismedtour.com, or our phone lines and WhatsApp, and we will get back to you as soon as possible, and I will see you in the next session to talk about the post-operative instructions for abdominoplasty. Thank you for being with me, and have a nice day.